friends, I am Bhujbal Pratiksha. So today I am going to discuss about ADR reporting. So in that first one is the adverse event, that is AE. So the adverse event is an any unfavorable or unintended sign which including abnormal laboratory finding, symptoms or diseases. Then for example, unwanted effects such as symptoms, that is headache, nausea, physical findings, that is BP, uh, edema, then abnormal lab values which increases the liver enzymes and decreases hemoglobin. Then second important thing is the adverse drug reaction. In the pre-approval clinical experiences, all the non-anxious and unintended responses to the medical product related to any dose should be considered as a adverse drug reaction. Then regarding to the marketed medicinal product, it is a response to drug which is a non-anxious and unintended and which occurs at doses normally used in the man for the prophylaxis, diagnosis and therapy for disease. Then next one is the unexpected adverse reaction. So the unexpected adverse reaction are the severity of which is not consistent with the applicable product information. Then the seriousness criteria. In that so the serious SEA or SAR is any untoward medical occurrence that results with the death, life-threatening, and which required inpatient hospitalization, then result in the persistent significant disability and congenital abnormal effect. Then the next one is the next is the disability. It is a substantial disruption of the person's ability to conduct a normal life functions. Then CFR 21, in that the significant, persistent or permanent changes and the damage or disruption in the patient function, structure, physical activities or the quality of that life. Then then the importance of medical events. For example, such events are intensive treatment in an emergency room and or at home for allergic blood dyscrasiasis and or convulsion that do not result in the hospitalization. So steps in now next is the step of ADR reporting. In that first one is the first step involves ADR monitoring. In that identifying a adverse drug reaction, then assessing a causality between drug and the suspected reaction by using algorithms, then documentation of the ADR, then reporting of serious ADR to pharmacovigilance centers, and then second is the assessment of ADR. It should be assessed based on the following criteria like seriousness, intensity, relationship of drug or expectedness or unexpectedness or the outcome. Now in the ADR reporting, two terms are important, that is serious versus severe. So the term severe is often used to describe a intensity or a specific event that happened after using the drug, and the severity is the outcome of that particular drug. So seriousness serves a guide for the defining regulatory reporting obligation. Then uh, the difficulties assessing the relationship of AE with the drug, which incomplete. It is the it is due to the incomplete information, that is objective criteria. Then the multiple drug is taken, then the variability of clinical responses and underlying illness, then the expectedness and the unexpectedness. So the expected AE is the expected AE is any adverse reaction whose nature or severity have been previously observed or documented for the study product. Then the unexpected AE or AR in the it is an it is in any adverse reaction that previously observed or whether or not it has been anticipated because of pharmacovigilance properties of the studies. Then the outcomes of adverse events. So in that, first one is the fatal, that is fatal describe the conditions, circumstances or events. Then second is the continuing, third is the recovering, fourth is the recovered, and last one is the unknown. And the significance of the ADR monitoring, it enhances the patient safety. Then the second one is the to keep a record efficiently, then to provide optimal information about the information to users, then identifying new information about the hazards associated with the medicinal product, then evaluate changes, benefit or risk. That's all. Thank you.